Now this is the pericardium of the heart. What you are seeing here is actually fibrous pericardium with parietal layer of serous pericardium. The visceral layer of serous pericardium will be attached to the surface of the heart, and that will be forming outermost covering of the heart, that is epicardium. So this is fibrous pericardium with parietal layer of serous pericardium. So within the pericardium, on the outer surface of the pericardium, we have the phrenic nerve and pericardiophrenic vessels embedded on either side. This side will be left phrenic nerve and left pericardiophrenic vessels. This side will be right phrenic nerve and right pericardiophrenic vessels. The inferior aspect of the pericardium will be sitting on the central tendon of diaphragm. Actually, the fibrous pericardium is a derivative of septum transversum, from which the central tendon of diaphragm is also derived. Now we are opening up the pericardium to show you the two pericardial sinuses. This probe is in the transverse sinus of pericardium. This is pulmonary trunk. You know it is arising from the right ventricle. This is ascending aorta and arch of aorta. So this will be on the right side of pulmonary trunk. So with pulmonary trunk and aorta anteriorly, a probe is passed through a gap. Behind that probe will be SVC, below will be IVC, and two right pulmonary and two left pulmonary veins. So this is called as transverse sinus of pericardium. Anteriorly aorta and pulmonary trunk, posteriorly the veins of the heart, SVC, IVC, two right pulmonary and two left pulmonary veins. This is due to degeneration of dorsal mesocardium embryologically. This space is often used to ligate aorta and pulmonary trunk when they are doing intracardiac surgery, when the heart is connected to heart-lung machine. So with pulmonary trunk and ascending aorta anteriorly, with SVC, IVC and the pulmonary veins posteriorly, the probe is now between these structures. This is transverse sinus, with aorta and pulmonary trunk anteriorly and veins of the heart posteriorly. There is another sinus also behind the heart, that is behind the base of the heart and the posterior mediastinum. There is another sinus. It's called as oblique sinus of pericardium. I am lifting the heart. This is the base of the heart. This is IVC orifice into the right atrium. This is SVC. Okay, so this is called as oblique sinus of pericardium. The oblique sinus of pericardium's roof is formed by left atrium. The floor is formed by posterior mediastinum, which will be containing esophagus, descending thoracic aorta and other posterior mediastinal structures. Its right wall is formed by IVC, SVC and two right pulmonary veins. Its left wall is formed by two left pulmonary veins. So left wall by two left pulmonary veins, that is reflection of visceral pericardium to the parietal pericardium from the left pulmonary veins on the left side. On the right side, it is a reflection of visceral pericardium to the serous parietal pericardium on the from the SVC, IVC and two right pulmonary veins. So roof is formed by left atrium, floor is formed by esophagus predominantly. So it is here when the left atrial enlargement happens, it will compress the esophagus, leading to difficulty in swallowing, which is also called as dysphagia. Oblique sinus is often used to approach the posterior mediastinum through the pericardial cavity. So remember, there are two pericardium, a fibrous pericardium and a double layered serous pericardium. Fibrous pericardium and parietal layer of serous pericardium is what you are seeing here. On the outer surface of the heart, giving a shiny appearance, is a visceral layer of serous pericardium, transverse sinus of pericardium and oblique sinus of pericardium. So this is the pericardium. We have cut and exposed the heart, retracting the pericardium. Now you can see on the left side the phrenic nerve along with pericardiophrenic vessels is embedded on the lateral surface of the pericardium. Similarly, on the right side is the right phrenic nerve along with right pericardiophrenic vessels will be embedded on the right surface of the pericardium. This is the fibrous pericardium with a parietal layer of serous pericardium. The parietal layer will become continuous with the serous layer at the roots of the vessels which are entering or leaving the heart, like arch of aorta and pulmonary trunk, which are leaving the heart, or the four pulmonary veins SVC and IVC which are entering the heart. So at the root of these vessels, the parietal layer will be continuous with the visceral layer. The visceral layer will be on the surface of the heart, forming the epicardium of the heart. It is inseparable from the myocardium of the heart. Now I am lifting the heart. What you are seeing behind is the oblique sinus of pericardium, which I have demonstrated in that specimen. The roof is formed by left atrium. Left walls are formed by the two left pulmonary veins. Right wall is formed by IVC orifice, SVC, and the two right pulmonary veins. The floor is formed by esophagus. You can see the esophagus, then descending thoracic aorta. This is esophagus. This is the main content of the floor. So if there is an elevation or enlargement of left atrium, it will compress the esophagus, leading to dysphagia. And you can surgically approach the esophagus also through the oblique sinus. So this is oblique sinus, left wall formed by left pulmonary veins, right wall formed by IVC, SVC and two right pulmonary veins. Roof is actually the upper end is blunt. It opens inferiorly. Floor is formed by esophagus and descending thoracic aorta. So this is the interior of the anterior chest wall. This is the sternum. These are the costal cartilages and these are the ribs. This is the costochondral junction. You can see the costal cartilage ending and the ribs fusing it, forming costochondral junction. So this is the sternal angle. So first rib is cut. This corresponds to second, third, 4, 5, 6, 7, 8, 9, 10 is not there. This is the costal margin. This is the xiphoid process. Xiphisternal junction, body of the sternum, manubrium sterni, manubriosternal junction corresponding to second rib, third rib, fourth rib, fifth rib, sixth rib, 7, 8, 9, 10 will be there. Now the muscle which you are seeing arising from the lower half of the inner surface of the body of the sternum, attaching to the second to sixth costal cartilages. This is sternocostalis muscle. This muscle. Deep to the sternocostalis, you can see the internal thoracic artery accompanied by internal thoracic venae comitante. For the branches of internal thoracic artery, so the sternal and mediasternal branches are not seen clearly, but I can show you the anterior intercostal branches. This is superior anterior intercostal artery along the upper border of each space, and this is inferior anterior intercostal artery given at the lower border of the space. Besides, it also gives sternal branches, mediasternal branches, pericardiophrenik artery. All these would have been removed when they removed the anterior chest wall. Now in the next specimen, I will be cutting the sternocostalis muscle and showing you the two terminal branches of internal thoracic artery. So this is the sternocostalis muscle clearly seen on the left side. Right side, I have cut the sternocostalis muscle to expose the two terminal branches of internal thoracic artery. So this is the internal thoracic artery. These are the two venae comitantes. This is the two terminal branch of internal thoracic artery. One is, which is on the lateral side, is musculophrenic artery. The one going on the medial side is superior epigastric artery. So superior epigastric artery has two venae comitantes. Musculophrenic artery has two venae comitantes. Both will fuse and accompany as two venae comitantes on either side of the internal thoracic artery. At the third intercostal space, both of them will fuse to form a single internal thoracic vein, which will accompany the internal thoracic artery, finally terminates into the brachiocephalic vein. So this medially oriented branch is superior epigastric artery. This branch is musculophrenic artery. The two terminal branches of internal thoracic artery given at the level of sixth intercostal space.